Introduction. Hi everyone, welcome to this video tutorial on lupus. Lupus is a complex autoimmune disease that affects many people worldwide. In this video, we'll explore the definition, pathophysiology, clinical manifestations, diagnosis and treatment of lupus, definition and pathophysiology. Lupus is a chronic autoimmune disease characterized by inflammation and damage to multiple organs, including the skin, joints, kidneys, and nervous system. The pathophysiology of lupus involves a complex interplay between genetic, environmental, and hormonal factors, leading to the production of autoantibodies and the activation of immune cells. Clinical manifestations. The clinical manifestations of lupus can vary widely, but common symptoms include skin rashes and lesions, joint pain and swelling, kidney damage and nephritis, neurological symptoms such as seizures and psychosis, fever, fatigue, and diagnosis. Diagnosing lupus can be challenging as the symptoms are often nonspecific and can mimic other diseases. The DiPiro book recommends using a combination of clinical criteria, laboratory tests, and imaging studies to diagnose lupus. Some common diagnostic tests include complete blood count (CBC), erythrocyte sedimentation rate (ESR), C-reactive protein (CRP), anti-nuclear antibody (ANA) test, kidney biopsy. The treatment of lupus depends on the severity and extent of organ involvement. The DiPiro book recommends using a combination of medications, including non-steroidal anti-inflammatory drugs (NSAIDs), corticosteroids, immunosuppressive agents, anti-malarial drugs, biologic agents. In conclusion, lupus is a complex autoimmune disease that requires a comprehensive treatment approach. By understanding the definition, pathophysiology, clinical manifestations, diagnosis, and treatment of lupus, healthcare professionals can provide better care for patients with this disease. References: DiPiro, J.T. 2018. Pharmacotherapy, the Pathophysiologic Approach. McGraw-Hill. Non-Pharmacological Interventions. 1. Rest and stress management. Rest is essential for managing fatigue, and stress management techniques like meditation, yoga, and deep breathing can help alleviate stress. 2. Exercise. Regular exercise, such as walking, swimming, or cycling, can help improve fatigue, joint mobility, and overall health. 3. Dietary modifications. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help manage symptoms. Some patients may benefit from avoiding certain foods, such as gluten or dairy. 4. Sun protection. Patients with lupus should avoid excessive sun exposure, use sunscreen with at least SPF 30, and wear protective clothing. Pharmacological interventions. 1. Non-steroidal anti-inflammatory drugs, NSAIDs. Examples: ibuprofen, naproxen, celecoxib. Indications: mild to moderate joint pain, fever, and inflammation. Dosage varies depending on the specific NSAID and patient response. 2. Anti-malarial drugs. Examples: hydroxychloroquine, chloroquine. Indications: skin and joint symptoms, fatigue, and inflammation. Dosage: typically 200 to 400 milligrams per day for hydroxychloroquine. 3. Corticosteroids. Examples: prednisone, methylprednisone. Indications: moderate to severe symptoms such as kidney inflammation, neurological symptoms, or severe joint pain. Dosage varies depending on the specific corticosteroid and patient response. 4. Immunosuppressive agents. Examples: azathioprine, cyclophosphamide, mycophenolate mofetil. Indications: severe or refractory lupus symptoms such as kidney damage or neurological symptoms. Dosage varies depending on the specific immunosuppressive agent and patient response. 5. Biologic agents. Examples: belimumab, rituximab. Indications: severe or refractory lupus symptoms such as kidney damage or neurological symptoms. Dosage varies depending on the specific biologic agent and patient response. Other treatments. 1. Hormone replacement therapy (HRT) for patients with lupus who experience hormonal imbalances, such as thyroid dysfunction or adrenal insufficiency. 2. Psychological therapy to address mental health concerns, such as depression, anxiety, or post-traumatic stress disorder (PTSD). 3. Alternative therapies like hormone replacement therapies,